So welcome everyone to the Brain Care, Physiology, and Psychology, Healing Your Life and Relationships by Healing Your Brain, the most important asset that you have. I am Jim Hendricks. I'm not the Muppet guy, nor am I the greatest guitar player who ever lived, just so you know. But I will be talking about how to improve the function of your brain and what goes when, and basically your brain is important and responsible for everything that you do. So a little acknowledgements and credits to my mentors, Daniel Amen of the Amen Clinics, who I've drawn heavily from, Michael Lyles, a psychiatrist in Atlanta, and Matthew Stubblefield, another psychiatrist in California. Dr. Amen is in California, though he has clinics in, I think, 8 states now. So you'll see more of his work. A little of my bio. I'm a nerd. I have a bachelor's degree in physics, a master's degree in engineering management, and a master's degree in psychotherapy. I'm also a Amen Brain Clinics health coach. I spent 10 years plus as a psychotherapist in private practice. I have 20 years study of SPECT imaging and brain science, 35 plus years as an engineer, 10 years as an educator, 27 years of untreated depression. So I know I know what I'm talking about from a sufferer standpoint. 13 years of medicated depression. Then I had my own mental breakdown from severe psychotic issues or psychiatric issues. I had a 4-year struggle with severe psychiatric issues, finally recovered, went back to my engineering practice, but now I empower high achievers who battle stress and mental health issues to improve their performance and basically get their life back. I give people more life in their years. So this is some breaking news from yesterday. I was on a call with Dr. Amen, and he said the average rate of depression is about 6% historically. In general, about 25% of the population will be impacted by depression in their lifetime. And in February of this year, that number was 8.7%. But in September, just last month, it was 25.7%. So last month was higher than the lifetime occurrence estimates in general, basically due to the coronavirus pandemic. This doesn't even consider the other mental health issues. And so mental health is really a huge deal. What you should get out of this series, what I really want you to get is brain envy. I want you to, oops, I need to let someone in. I want you to see the normal brain SPECT images and the images of other people and things that they have happened to degrade their performance and say, I don't want that brain, I want the good brain. I want you to learn about killing ants, which are automatic negative thoughts, so you can take control of your life again. I know I have automatic negative thoughts that have been living in there for a long time. A lot of them I've been getting rid of recently. I want you to be able to respect the delicateness of your brain and protect it, both from traumatic brain injury as well as toxic exposure. Understand brain issues and how they impact your life, that they're not just one thing in general. Options for treating the brain, both medication and natural. Care and feeding of your brain. The good news is, and I'll give you the good news up front, your brain can get better if you treat it right. You should get better relationships and be able to make better decisions, and on and on. So what should you get out? Oh, I did that already. I hit the button, go button. If I let somebody in, I have to change. So you don't want Homer Simpson's brain. When it comes to the brain, size matters. We talked about the good news already. We'll talk about your brain. We'll talk about SPECT scans, and I'll tell you what that means. Brain structures, brain defects, mental disorders, substance abuse and toxic exposure, and healing the brain from all of these things. You don't need previous understanding of brain function and physiology for this class, this course. And even if it feels a little deep at times, stick with me because it will get better. And it's not, you don't need to know all the gory details. You'll be able to read a brain scan pretty well by the time we get through today. All right, so specific topics for the 8 sessions are listed here. An introduction, and we'll talk about the limbic system. We'll talk about ADHD, anxiety, and PTSD, OCD, violence, bipolar disorder, schizophrenia and brain trauma, drug, alcohol, and toxic exposure, strokes, Alzheimer's Alzheimer's disease, and toxic exposure and obesity, killing ants, care and feeding of your brain, and there'll be some surprises along the way. So what's the problem? Well, this is for the United States. Brain-related problems affect 200 million people at some point in their lives. The population of the United States as of last year, 2019, was 328 million. So that's almost 2/3 of people will be affected by mental health issues in the course of their lifetime. The bigger problem than each of these things individually is that people hide the fact that they're having a problem. They suffer in silence and they don't get help. I think that's a horrible situation. And part of my goal in life is to help get rid of that stigma so people will reach out. The traumatic results that happen otherwise are just unfathomable. So there are things like brain fog and memory problems, depression and anxiety, insomnia, attention issues, and being overweight or obese. And actually being overweight decreases the size of your brain. And again, where the brain comes in, size matters. So 14 warning signs your brain is in trouble. If your brain is having memory troubles more than you had 10 years ago, memory problems are not a natural condition of aging. Even though I guess I should say they shouldn't be a natural condition of aging. You can make your brain better as it ages, as opposed to letting it decline. Low energy, low mood, irritability, anxiety, stress, and worry, short attention span, brain fog, impulsivity, making bad decisions, insomnia, high blood pressure, high blood sugar, weight issues we talked about a minute ago, sexual dysfunction, and non-compliant for health. If your brain is not working right, oftentimes you won't be willing to follow the doctor's advice. Okay, so I mentioned the good news. Here's a little more about the good news. Your brain creates new brain cells every day, hundreds of thousands of them. It used to be thought that the brain didn't regenerate brain cells, but we found that it does. Your brain can recover from toxic exposure, from drug and alcohol abuse, from traumatic brain injuries. Sometimes they're very traumatic and the amount of recovery is not what you'd like, but you can get better. Treated from psychological issues and treated for violent behavior. Currently, we put a lot of people in prison that could be rehabilitated just by treating their brain. Your brain is complex. There are more connections in your brain than there are stars in the universe. It determines who you are. Every aspect of what you do, what you think, what you say is governed by your brain. It is the most important asset that you have. It's involved with everything you do. It's the hardware on which you run. It's very soft and very fragile. And your skull, unfortunately, is very hard and has ridges. And I'll show you that. So your brain is about the consistency of soft butter, tofu, somewhere between egg whites and Jell-O. And your skull, as you can see here, You know it's nice and hard, but you can see these ridges, and let me turn on my laser pointer, which I found the other day, which is very cool. So these ridges here sit right in front of your temporal lobes, which we'll talk about, and it's as sharp as a knife. So getting jostled around inside your skull, even doing something which we would think is as innocuous as hitting a soccer ball, can cause brain injury. I'm going to talk about SPECT scans a lot, and like I said, you'll be able to learn to read them fairly easily. That's how you get brain envy, is looking at these things. It's a window into how your brain works. It identifies what in the brain is working well, what's working too hard, and what's not working hard at all. It's a medical imaging study that looks at blood flow and brain activity, as opposed to a functional MRI, or sorry, an MRI, which looks at the physiology, the structure of the brain. So here we're looking at activity, basically. The two brains that you see, the one here is a normal brain, and normal is subjective. There aren't a lot of normal brains out there that have been found by doing close to 175,000 brain studies with SPECT imaging. It should look very smooth, and you'll see examples such as this one. After heavy heroin use, it's basically got holes in it where it's not functioning. They're not physical holes. It's not Swiss cheese necessarily, but they're areas where it's basically not working well. You can see that this poor heroin user doesn't really have a chance to be the person that they started out. This is what a SPECT scanner looks like, just for fun. It's basically like an MRI machine, except it only covers the person's head, although there are SPECT scanners for heart and lungs. This one is specifically designed for doing brain imaging. And I have two people in the waiting room, which I just let in, I think. So, SPECT scanner. And switch back over here. Sorry about that. And sorry I left the two of you that just came in the waiting room too long. My apologies. SPECT Can Diagnose. SPECT stands for single photon emission computed tomography, and it can diagnose things like resistant emotional, behavioral, and cognitive issues, memory and dementia problems, traumatic brain injuries, concussions, behavioral problems, aggression, addiction, autism, ADD and ADHD, and not only something like ADD and ADHD splitting the two, but there are actually, from SPECT imaging, there are 7 different types of ADHD, which it can identify. Mood disorders, anxiety disorders, schizophrenia, differentiated types of subtypes of disorders previously thought to be one disorder. For example, anxiety, depression, and bipolar are actually related, and they're on a spectrum, and more, lots more. So SPECT uses a radioisotope, typically technetium-99 for the nerds in the group. It's combined with a pharmaceutical that is either HMPAO or ECD, which are just two pharmaceuticals that are easily taken up into brain tissue. And it's basically then again to measure regional blood flow in the brain. You can also measure receptor activities, and it takes a long exposure. The image happens in the injection room, which is different than an MRI, for example. There's no magnetism involved, so it doesn't matter if you've got metal in your body. It takes up to 6 hours after the, or I should say, you can scan the person up to 6 hours after the injection, which is a definite benefit. It kind of like freezes the brain activity picture for 6 hours, even though the person's brain isn't frozen for 6 hours, if that makes sense. All right, here's a normal brain scan. And like I said, there aren't many normal brain scans. They actually did a study where they tried to scan 3,000 people, or they screened 3,000 people, and the people had to have the qualities of no mental illness, no history of mental illness, no history of drug or alcohol abuse, no head injuries, and there were a few other criteria. And out of 3,000, they came up with about 150 people who qualified as normal, and basically they came up with a few scans. Over the course of doing 175,000 scans, the Amen Clinics has only come up with a few normals. So it should be smooth. The color in this particular case doesn't really matter. It's just that it should be smooth and uniform. On the other side, so this is the back of the brain. This is the front. My mouse, my laser pointer is lagging. Sorry about that. This is the front and this is the back. This is looking from the top down. This is looking from the bottom up. You can see where this would sit in that bony structure that I showed you earlier. This brain actually is showing a little bit of degradation in the prefrontal cortex, which we'll see is basically what makes you human. This is the deep structures view of a SPECT image. The cerebellum is, which is back here. The white area in the back, I'm not going to point for a minute because it's seeming to have trouble. The back area that's lit up white, and you'll see that the hottest parts of the brain, the parts that are working the hardest, are white in the typical scan. So normal. So here is an example of Mr. or Mrs. Abby Normal, if you're a Young Frankenstein fan. This particular one shows that there's significant ADD, ADHD, lack of being able to think things through. They've also got some left temporal lobe issues, and I'm pointing to the right side, I know, but if you think I'm looking at the bottom up, so if we turn it over so it's right side up, the left side is the right side. Does that make sense? I hope so. So when people see these things, patients and families see problems as medical, not moral. It dramatically decreases shame, guilt, self-loathing, and anger. It increases forgiveness and compassion, increases compliance, and there's nothing else in psychiatry that has this powerful or immediate an impact. So the Amen Clinics method, which is what I use basically, is a detailed clinical analysis looking at biological, psychological, social, and spiritual aspects of a person's background and history. SPECT imaging when it's appropriate, sometimes targeted lab studies, and basically all of these things lead to a personalized diagnosis that's much more accurate and actionable than a typical visit to a psychiatrist. And plus, we add brain healthy habits to boost the brain and boost its reserve. So if you think of normal being down here and, normal being here and overwhelmed being up here, you want to increase the space between normal and overwhelmed. In everyday life, modern life, we seem to have overwhelmed get closer and closer. So if something happens, you smack up into overwhelmed. These approaches help to increase that space. And you'll see that includes things like meditation and deep breathing, use of supplements as opposed to drugs, and various things like that. So a full evaluation, including brain scans, would look something like this. And I'm not going to go through all the details really, but I'll give you a highlights. The background information is really extensive. They do a neuropsychological assessment that looks at things like how well you can recognize facial expressions and trying to think of the right word, kinesthetic aspects of brain function. You spend 2 hours with a historian. You get two brain SPECT scans, one at rest and one at concentration, because as we'll see, they're different. And a final evaluation with a psychiatrist. They set up a medication protocol if it's appropriate, and they give reports and all of that. There's follow-up visit, as well as they follow up at 6 weeks, 3 months, and 6 months to see how you're doing. That's all covered in the cost of a full evaluation with them. I do a lot of these things with assessments that have been developed by them that are sort of similar to a brain scan that came from doing all of these brain scans, and give you a first pass assessment of whether various parts of your brain are working well, working too hard, or not working well enough. All right, so one thing you want to know for everybody, just health-wise in general, you want to know your important numbers, BMI, weight to height ratio, hours of sleep. I have 2 more people in the waiting room. I have to watch that. Blood pressure, CBC, general chemical panel, blood fasting, sugar, lipid panel, A1C, vitamin D levels is really important. Thyroid panel, looking at both T3 and T4 antibodies, iron levels, free and total testosterone for both men and women, cortisol levels, DHEA, which is a testosterone precursor, and EPA is a component in fish oil, and AA I don't remember off the top of my head. All right, so you all wonder if there's a difference between men's and women's brains, and of course there is. You can see from this graphic that, okay, so it's a joke, but there are differences between men's and women's brains. Men have more brain cells, but women have far more brain connections. And there are a number of other factors that come into play. Boys and girls' brains as they mature are different. Boys mature at about 28, while girls mature at about 25 for their brains. There are things that happen as a function of age. Little kids' brains are very busy. They're not necessarily bipolar, as we'll see later. And women's brains, it also is a factor of when in the time of their menstrual cycle they are. The brain changes as a function of hormones. So there's all kinds of things that are different between the two brains, let alone all of the psychosocial things that go on. All right, so not getting deep. This is just to give you sort of an idea of the parts of the brain that we're going to be talking about. Frontal lobe is the part that makes you human. It is the executive part of your brain. For a lot of people, it's the cop that tells you to be good. There was a comedian who said the best, I can't remember the comedian's name, but he said the best way to avoid speeding is to have a cop in your rearview mirror. The frontal lobes are kind of the cop in the rearview mirror. They keep you from doing bad things. So frontal lobe, executive functions, and we'll talk about that in detail, what each of these things do. Parietal lobe, if you took your hands and put them on top of your head and put your thumbs in your ears, the parietal lobe is what your hands are over. Occipital lobe is in the back of the brain. It's your vision center. Cerebellum has the most neurons in the brain. It's got half of the neurons in the brain, and it's responsible for things like balance. And we'll talk about other parts of that. Temporal lobes are on the side, and we'll talk about what those are used for as well. So here's another view of the brain, and the only reason I'm showing this is to show you the deep limbic system, which is here. And it basically consists of a whole bunch of different sub-organs in the brain. So that wasn't so bad, right? So psychiatric disorders, pain, pain, hopelessness, despair, and denial. Denial is the state that most people are in with psychiatric problems. And again, that's my crusade, is to help obliterate the stigma that people have around mental health issues. We all have issues at some point or other, and it's important to get help when needed. So this is an old slide, but at the time, brain disorders were affecting the order of 1.1 billion humans. Total population now is something like 7 billion. I think this number is low, but there are parts of the world where stress is much less, which I think helps a lot. I'm sure of it. All right, so deep limbic system. Again, it's this area here. It shows up on the scan as a white spot when you have it running too hot. When it's functioning well, it sets the emotional tone of the mind. It filters external events through internal state or emotional coloring. You might think of that as when you think things are good, they're good. And when you think things are good, you're feeling good, everything seems to be pretty good. But if you're feeling bad, it will also color things in a negative way, which we'll see on the other side. It tags events as internally important. It stores highly charged emotional memories. And actually, what happens in PTSD is the memories get stuck in the deep limbic system and don't get processed out, which is supposed to happen every night when you go to sleep. These tagged memories get stored away in the appropriate parts of your brain. It modulates motivation. It controls your appetite and sleep. It promotes emotional bonding, directly processes your sense of smell, and modulates your libido or your sexual interest. When you have problems, you have moodiness, irritability, and clinical depression, or CAN. Increased negative thinking. You perceive events in a negative way, decreased motivation, flood of negative emotions or filtering. And basically, if you're feeling negative, you tend to see everything as negative. It, again, is responsible for appetite and sleep problems, for decreased or increased sexual responsiveness, and social isolation. So bear with me for a moment. If there was a disease that affected nearly a fifth of Americans, forgive me for not having an international number, was potentially fatal, could wipe out marriages and families, usually destroys jobs and careers, leads people to self-medicate with alcohol and drugs, makes diabetes, hypertension, cholesterol problems worse, decreases your immune system, increases mortality rate after a heart attack, increases chance of miscarriage, increases chance of premature menopause, and may cause early cognitive decline or dementia. It affected women twice as often as men internationally, had treatments that worked 75 to 85% of the time, but only 21% of people were treated. There should be an outcry, but there's not. Instead, it's a disease that causes people, especially women, to suffer in silence, put on a mask, and isolate, blame themselves, and die a slow death inside. This disease, of course, is depression. And you might think everybody gets depressed at times, and everybody does get sad at times. It can be a natural reaction to loss. It can be secondary to fatigue, sleep deprivation, stress, or poor diet, a reaction to anger or upset, reaction to guilt, reaction to failure, and all of those things are true. It can be the consequences of having it untreated, if it's really depression, or psychological distress. 70% of people with depression also suffer with anxiety, marriage and family dysfunction, disability, substance abuse, suicide, and recurrent disease. And I'll talk about that in particular later on. So I mentioned this, it makes heart disease worse. It makes this possibility of stroke more possible, increases the risk of diabetes, and increases the risk of bone mineral density decline. The big consequences are things like hypertension, diabetes, high cholesterol, heart attack survival, stroke survival, pain syndromes, and parahippocampal atrophy, which basically means that part of the brain gets smaller. And again, smaller brain, never good. Dementia and premature menopause, which I mentioned. And you might think, why wait to treat depression? Well, it'll go away with time. Yep, sometimes. It'll go away with exercise. As a matter of fact, exercise has been found to be as effective as antidepressants over a 10-week period. It will go away with diet, nutrition, and supplements. Absolutely true. It will go away with relationship changes. That can definitely be an issue. Job changes, of course. With sleep, sleep is the most underrated aspect of our life, I think. People get the impression that they can do without sleep, go on a minimum of 4 or 5 hours, but in reality, a person should sleep 7 to 8 hours a night, or their brain will be degraded. And it'll go away with a spiritual change, and that can be true as well. But if it's the real deal, it's more like cancer. It'll come and go. It'll get worse with each episode. It'll affect more and more of the body and requires more aggressive action. Depression is not just chemical imbalance. Depression is a systematic medical problem that can cause brain degradation. And we don't want brain damage, guaranteed. Oops, that was weird. So depression is a symptomatic illness. It causes emotion and physical signs like depressed mood, anhedonia, or loss of interest in things that you used to be interested in is a classic sign. Hopelessness, low self-esteem, impaired memory, difficulty concentrating, anxiety, headache, fatigue, disturbed sleep, dizziness, chest pain. And I would get past this slide much faster if it would just cooperate with me. Vague joint or limb pain, vague back pain, abdominal pain, GI complaints like nausea, vomiting, constipation, diarrhea, and gas, sexual dysfunction and apathy, menstrual problems. And this is just a pretty picture showing the limbic system. You don't have to know anything else about it. You can see the limbic system identified here in the center. This is a picture of a synapse. You can see the neurotransmitters as the little dots in there. The synaptic cleft is between the two synapses. And again, more than anything, it's just a picture to give you an idea. Here's a cartoon. I like cartoons showing two neurons with the synapses, and a zoom in shows the same picture as before, but you can also see mitochondria, the little vesicles that are holding the neurotransmitters, and the neurotransmitters going across the synaptic gap. Again, you don't have to know that. This is just a pretty picture. So in your brain, there are about 100 billion neurons, and each neuron has about 10,000 synapses. That's a lot of on-off switches in your brain. Okay, so neurotransmitters simplified. Serotonin is responsible mostly for, when it's out of balance, worry and fear. Norepinephrine provides energy and motivation. Dopamine is perception, mood, cognition, pleasure, and motor skills. Glutamate for mood stabilization. GABA modulates anxiety, and norepinephrine and serotonin modulate pain. I talked about brain atrophy in depression. Here is a PET scan, not a PET scan, an MRI, and you can see a normal hippocampus here. And here's the blow up of it. That was what I was looking for. And if you see the person who's depressed, that hippocampus is smaller and squashed. I'm not going to go through this in much detail, but basically the brain creates a signal from the pituitary gland that sends a signal to the adrenal glands that generates hormones to the heart, which cause problems, that to the arteries that cause hardening of the arteries, and to the to the blood sugar modulating functions that cause diabetes and obesity. All right, so this is the graph I was talking about. So the longer you have been depressed, the less likely you'll be to recover without treatment. And so the message is basically get treated. This is showing the number of months or years that the person's been depressed and the decrease in the recovery rate. And here it's showing the number of times you've been depressed, and again, the recovery rate or risk of being relapse basically going up. So again, it's important to get it treated. Doesn't have to be medication, but it's really important to get it treated. So depression's not just one thing. It also can be co-occurring with other parts of the brain. So in this first one, you see that the deep limbic system is lit up. It's in red in this particular case. And you see the hole in the prefrontal cortex, which is indicative of ADD or ADHD. And those two things together result in moodiness, negativity, low energy, sleep and appetite problems, and poor concentration. And it responds best to a dopamine or a noradrenaline intervention. For this particular subtype, this structure here that goes all the way across the top of the brain is called the cingulate gyrus. The anterior cingulate gyrus is kind of like the brain's gear shifter. We'll talk about this later, so you don't have to remember. But it's involved with this type of depression is got sadness, negativity, irritability, worrying, cognitive inflexibility, which is the part that's being played by the cingulate gyrus, worrying, getting stuck on things, or locked into negative patterns of thoughts. That's a bad combination, although this one is worse. This one has got low frontal lobes, so they aren't able to think things through. The deep limbic system is firing too hot, so they're sad. And the left temporal lobe, which among other things is responsible when it's down for violent behavior, either to themselves or other people. This is a very dangerous type of depression. And in this particular case, serotonin and an anticonvulsant is most likely appropriate. And typically you want to treat use the anticonvulsant to treat the low temporal lobe first, and then address the other issues. Okay, so treatment. Learning to kill the ants, the automatic negative thoughts, is really important. You want to lower your risk factors, which are things like bad fats, smoking, blood pressure, and weight. For women, you want to look at estrogen issues. You look at antidepressants in some cases. Cognitive behavioral therapy works very well, as does psychoeducational groups. Groups are extremely powerful. Intense exercise, as opposed to just any exercise. Intense exercise, if you're not familiar, is basically the type of exercise where you do it for a shorter period of time, but you work very hard during that short period of time. For women, soy and black cohosh can help with the estrogen issue. Not good for men, neither of those, because they increase estrogen and decrease testosterone. DHA omega-3 fatty acids, so fish oil and flaxseed oil, you want higher in DHA than EPA. SAMe is a supplement also, as is 5-HTP or L-tryptophan. Those both increase serotonin, as does saffron, B6, B12, and folate. Folate can help with an overfocused anterior cingulate gyrus, which is the front part again. And to increase bone density, you want calcium and vitamin D, weight-bearing exercises like lifting weights, and alternatives to osteoporosis for people who are very far down the line. You've got medications like the ones listed here. All right, so limbic system medications and supplements. These are examples. Wellbutrin treats a low prefrontal cortex as well. Effexor treats low prefrontal cortex and anterior cingulate gyrus, as well as the deep limbic system. Cymbalta treats the prefrontal cortex and anterior cingulate gyrus, and SSRIs can treat the anterior cingulate gyrus. People with problems with their limbic system can often have pain, and Cymbalta, Lyrica, and Neurontin actually can be used to help with pain, as opposed to opiates that turn out to be poison for your brain, unfortunately. Supplements, instead of medications, you have things like SAMe, 5-HTP and SAMe for this particular condition, and this one, 5-HTP alone, if you would use a serotonin reuptake inhibitor by itself. For pain, SAMe and fish oil are both very useful. There are foods that boost serotonin, complex carbohydrates, smart carbs, if you will, things that are high in fiber and slower to digest, like sweet potatoes, apples, blueberries. But you want your blueberries to be organic, if at all possible, because blueberries are the highest sprayed crop in general. Carrots, garbanzo beans, eating foods rich in L-tryptophan, chicken, turkey, salmon, beef, nut butters, eggs, and green peas. Okay, general principles. Take care of yourself is the biggest one. It doesn't have to be like the picture on the right, even though sometimes it can feel that way. But education, reassurance of the person, support, counseling, stress management, meditation, prayer, diaphragmatic breathing are all extremely important. Diet and exercise, sleep, relaxation, faith, and medications when you need them. Special considerations in medication therapy, things like weight gain are often a problem with medications, and sleep and carb restriction and resistance exercise help. You typically don't get that with supplements. Sexual dysfunction, again, you don't get with supplements, but you can get them with meds. You can change the meds, you can reduce the dose for a while and then bring it back up. You can change timing of dose or the timing of when you have sex relative to when you take your medication. You can take adjunctive medications like Wellbutrin, have topical testosterone gel, Viagra, Estetest. And when I ran a previous version of this, somebody asked, well, what about women? Well, there's a medication called Addy, I don't know how to say it. But anyway, it's approved by the FDA for treatment of sexual desire in premenopausal women. And you can also Google female sexual enhancing substances, and it's safe. I tried it; it wasn't it wasn't a trap. There's a whole list of things that are there that are possibles for that. Okay, so just one slide of a case, a female who was 26, who unfortunately had 2 prior violent rapes at 15 and 22, a physically abusive love relationship, along with the death of 8 friends between the time she was 14 and 16. Her symptoms were depression, anxiety, worry, and drug use. And basically she was in a drug use kind of situation. So that's why her part of why she was around 8 friends who died, or yeah, 8 friends who died. But after 4 therapy sessions with something called EMDR, which is basically a light therapy where you have a light bar and lights go back and forth and your eyes follow the lights while the therapist walks you through the traumatic event, and basically keeps your brain present instead of having it go off into a PTSD kind of flashback. So you don't relive the experience, you're able to process it. A month of St. John's wort, which you have to be careful of because St. John's wort makes, I can't think of the right word, birth control pills not work. So just be on the safe side there. She felt significantly better. And you can see from her brain scan, like I said, it's easy to see. Her brain was all lit up before medication, and here, anterior cingulate gyrus and the middle cingulate gyrus and the back part were all lit up. You can see the depression centers down here in the limbic system, but after medication, it's nice and clean. Only the cerebellum is lit up, which is what it's supposed to be. Same here. It's easy to see the difference. That's why these are so powerful. It makes people want to comply with their treatment. Okay, so there's another aspect to depression, which is that there is something called male menopause, really. And it happens in men. It starts about in their 40s when their testosterone really starts to decline. The physical symptoms are loss of body hair, thinning or dryness of the skin, anemia, obesity, headaches, decreased muscle strength, and increased fatigue. Balding doesn't predict it, just so you know. And it's overrepresented in men with diabetes and asthma. The symptoms are depressed mood, low self-confidence, fearfulness, irritability, low libido, poor tolerance to stressful life events that were previously handled more effectively, and treatment-resistant depression. Other causes, low zinc deficiency, or sorry, I should say low zinc deficiency, elevated prolactin. So other causes of low testosterone, zinc deficiency, hormone levels, fat-lowering medications like cholesterol medications, saw palmetto and flaxseed oil. Saw palmetto is good for your prostate, but bad for your testosterone. So there are testosterone replacements, patches, pills, gels, and injections. DHEA is a precursor, but it doesn't always work. It takes 4 weeks to see an antidepressant benefit at least. You want to avoid in people who have bipolar, prostate cancer, pedophilia, antisocial or aggressive states. Exercise, diet, and weight control also help. All right, so we're getting to the end. Avoiding bad things for your brain is one of the big issues here. So you want to avoid chronic stress, brain injuries, drug and alcohol abuse, obesity, sleep apnea, diabetes and high blood pressure, toxins. We'll see a lot of these things later, but I wanted to put them all here just so that everybody got a chance to see them up front. Poor diet, high sugar intake is extremely bad. Untreated depression and PTSD, lack of exercise, making bad decisions, poor peer group choices. You're going to be like the 5 closest people in your life. Not knowing one's own vulnerabilities. To do good things with your brain, you want to make good decisions, have a positive peer group, protect your brain, have a clean environment, maintain good physical health and a healthy weight, get 7 to 8 hours of sleep nightly, engage in new learning. It helps keep your brain alive and growing. Eat a healthy diet, manage stress and automatic negative thoughts, exercise regularly, and take brain healthy supplements. For example, for everyone, a multivitamin, omega-3s, fish oil, if you will, vitamin D, and other brain healthy nutrients. So the takeaways: always make your mouse wear a helmet. That was a joke. So basically, you are your brain. It's soft and your skull is hard, protect it. No matter what you've done to your brain, it can get better. SPECT scans measure blood flow and brain activity and can play a vital part in diagnosis and treatment of a wide variety of issues. Depression is a serious illness and can lead to other physical problems. It is a biological illness. Depression is not just one thing, and low testosterone can cause depression. And that is the end. At this point, you can unmute your microphones and I'll take questions, comments, complaints. I apologize again for the internet connection.
That was great, Jim. Thank you very much. And the internet connection was pretty smooth. Only when you froze, it was completely down. But otherwise, there was no problems at all. And I really enjoyed your presentation. Thank you so much, Jim.
Thank you.
Thank you, Jim.
You're quite welcome. You get the gallery view here so I can see you all.
Thank you, Jim. That was a big nugget to swallow, but definitely with the takeaways at the end. Yeah, there's some things we can implement. So thanks.
It gets easier as we go along because you get used to what you're looking at. But you'll see it's really, in most cases, it's really that straightforward. You can look at one picture and look at the other one and say, oh my, I don't want that, I want this. And the interventions are pretty straightforward as well. If you can take some supplements and improve the function of your brain, regardless of age, regardless of condition, I think it's a huge benefit.